The World Health Organization is calling for urgent action to tackle the increasing death toll caused by air pollution, with 90% of the global population exposed to hazardous levels. Research co-led by the University of Queensland and Carnegie Mellon University has found that sharing real-time air quality readings in developing countries can help by reducing air pollution and leading to lower mortality rates. ANDREA La Nauze, lecturer at the University of Queensland School of Economics, joins us now. ANDREA, great to have you with us today. Now, this research was essentially sparked by a US embassy in Beijing that started tweeting about live air quality updates back in 2008. Is that correct?
Yes, that's correct. So the US Embassy installed a pollution monitor at their embassy in Beijing and started providing that information publicly via Twitter. And that was some of the first information that was publicly available for citizens and visitors to the city at the time.
Now you've looked at 36 countries to analyse the data, which seems to show that it's all about increasing local public interest.
So that's our hypothesized mechanism. So we look at pollution measurements using satellite-derived estimates, both before and after a US embassy in a city started tweeting out real-time air quality readings. But we also go and look for supporting evidence for what's behind that effect by looking at Google Trends. So what we show is just as we see a decrease in pollution in cities with a US embassy monitor, we see a dramatic increase in the number of Google searches for terms like air quality monitoring or air pollution. And so that's consistent with people being more attentive to air pollution in those locations, and that there being a lot more attention by politicians and presumably a whole lot of pressure to actually address air quality issues.
Now, how do these kind of results that you've just been discussing compare to the other non-OECD countries without the embassy monitors?
Yeah, so actually our estimates are based on that comparison. So as I say, we use satellite measures of pollution in the cities that receive a monitor. We compare pollution before versus after the monitor was installed and the US embassy started tweeting. We compare that change to changes in pollution in similar cities that didn't receive a monitor over the same period of time. So we actually find that there's a reduction in comparison to those other cities.
Now, clearly, reducing air pollution is going to save lives. It's also got to, as a result, have a significant impact in terms of national healthcare budgets. How much research has been done into that?
I think that's a really interesting question, and it's certainly a very important one for governments who are considering reducing pollution and improving air quality standards. It's not something that we look at in this paper, but it's certainly a very important area of future research.
Now, the cost of monitoring the technology, of course, is there as well. Who should essentially be paying for this?
Well, again, that's a very interesting study. So traditionally, local governments have provided their own monitoring as a form of public good. But increasingly, we're actually seeing private citizens installing their own very low cost, cheap air quality monitors and uploading that data. So for example, websites like Purple Air now contain maps based on pollution measurements at hundreds of monitors in a city, whereas the local public monitoring network may have very few monitors. So for example, Sydney in Australia has approximately 20 public pollution monitors. A Purple Air map may have hundreds of monitors in that same city.
Now, what sort of pressure, Andrea, is being put on authorities to act based on this information in this paper that you've released?
Well, we've actually spoken a little bit to the US Department of State, who were very interested in the results and the effects on pollution. So there were some claims by US diplomats prior to our study that their program had led to reductions in pollution in host cities, but there was actually no evidence for that statement. And so you can view our results as actually backing up this program, which is you can think of as a form of development assistance of the US Department of State. And Australia, for example, could engage in similar programs in our region.
So, Andrea, what would you really like to achieve from this research?
So the World Health Organization has been calling for increased monitoring, particularly in least developed countries who have a high pollution burden, but also have fairly low access to existing monitoring. And our results, our evidence, really supports their promotion of better monitoring in these locations.
So what's next for you and the research team from here?
So we would love to do follow-up studies, in particular to understand exactly what led to the reductions in pollution. So, for example, it could be that there were restrictions on vehicles and fossil fuel consumption of those vehicles. It could be that there was increased regulation on industry. So we'd really like to follow up exactly what led to those pollution reductions, to think about more broadly what are the costs versus the benefits of these improvements in pollution.